Good afternoon, and welcome everyone to the Senate Committee on Health and Human Services for the 83rd Legislative Session. Madam Secretary, please proceed to call the roll.
Senator Lang, Senator Stone, Senator Taylor, Senator Titus, Chair Doniate.
And I'm here. And please mark Senator Lang present when she arrives. Good afternoon, everyone, and thank you so much for coming today. We have a pretty eventful day that we are going to be doing a lot of stuff with Senate bills and then also having our work session. And so today, as you may have seen, we have a pretty eventful agenda, and so I'm going to go over the order as to what we're going to do today. Just please be mindful that I may take things out of order depending on if we have folks here and if we don't and so forth. And so today we do have 5 bill hearings on Senate Bills 408, 409, 410, 423, and 434. And then we also have a work session that we have to get through, of course, on today's agenda. Of course, I mentioned that items may be taken in a different order, and I'll go over the order in just a second. And then obviously that a discussion of an item on the agenda may be delayed at a different time. For folks that would like to testify today on the bills, we ask that you please sign in at the table by the door and provide a business card to our committee secretary. And if you do not wish to testify, you may still want to sign in so that there's a record of who is interested in a particular bill in the event the committee needs to contact you later. When testifying, you can turn on your microphones on to speak and off to listen. And we have listeners and viewers in Las Vegas and online, and we are recording this meeting. We asked that public comments be kept to 2 minutes so that everyone interested in speaking can be accommodated and that we can get through the agenda in a timely fashion. And then, of course, speakers are urged to avoid repetition of comments made by previous speakers. We have a lot of bills today, so obviously if we can just condense our comments so that we have an appropriate time for everyone to speak would be greatly appreciated. And then, of course, we ask for folks to please turn off their electronic devices, especially their cell phones, and put them on silent mode during the meeting. And now, what everyone's waiting for, the order for today. We're going to start first with our work session because all the members are here, and so we'll do that first. And then we will move on to Senate Bill 434, which is with Majority Leader Canizaro. Followed by that, we will do Senate Bill 423. That's with the folks from our public health folks, and then we'll move on to Senate Bill 410, and then followed by Senate Bill 408, and then last but not least, Senate Bill 409. So that's the order for today. So it's 434, 423, 410, 408, and 409. So obviously, for the bills that are later on, you're more than free to leave and come back as we go through the motions of the bill. But that's the order for right now. And so to start us off, I am going to start with Ms. Cooper on our work session document, and we'll start off with Senate Bill 187. Ms. Cooper.
Thank you, Chair. Destiny Cooper, Committee Policy Analyst, LCB. For the record, as nonpartisan staff, I cannot advocate for or against any of the measures before you today. Senate Bill 187, sponsored by Senator Pazina, revises provisions relating to child welfare. It was heard on April 1st. Senate Bill 187 makes various provisions regarding child welfare. Among other items, it requires child welfare agencies to make decisions regarding medical or mental health treatment for children in their custody within 14 days of request. Senator Pazina proposed the attached amendment, which in summary deletes Section 1 and 3 through 18 and revises language in Section 2. Please see attached for the details. Thank you.
Thank you, Ms. Cooper. Committee members, do we have any questions? Senator Tice.
Thank you, Mr. Chair. Just looking at this amendment, certainly it looks like I may be able to be on board, so I'll be supporting this audit committee.
Thank you. Any other comments or questions? At this time, I'll go ahead and take a motion to amend due pass Senate Bill 187.
So moved. Second.
We have a motion from Vice Chair Taylor and a second from Senator Stone. Any discussion on the bill? Senator Titus.
Yeah, I will be a yes with a right to reserve.
Thank you. Any other comments? All those in favor, please say aye. Aye. Any opposed? The motion's carried, and I will go ahead and sign that floor statement to Senator Pazina. Let's move on to Senate Bill 217. Ms. Cooper.
Thank you. Senate Bill 217 makes revisions relating to reproductive health care, sponsored by Senators Canizaro, etc. It was heard on March 20th. Senate Bill 217 establishes certain rights related to assisted reproduction and with specified exceptions prohibits a governmental entity from enacting or implementing any limitation or requirement that singles out assisted reproduction and burdens assisted reproduction services. The bill outlines and provides that a fertilized egg or human embryo that exists before implantation is not a human being under Nevada law. Additionally, this bill requires Medicaid and public and private health plans for groups of more than 100 insureds to include coverage for the treatment of infertility, which was amended out. Senator Canizaro proposed an amendment which in summary delays the implementation date for Medicaid by 1 year, amends the coverage requirement to apply to plans with 50 or more employees rather than 100, defines standard fertility preservation services, and the rest can be found attached. Thank you.
Thank you, Ms. Cooper. Any questions from committee members? I'm going to do the motion to amend do pass, and then we'll go to discussion. Do I have a motion? Thank you. Do I have a second? We have a motion from Senator Lang to amend do pass and a second from Vice Chair Taylor. Moving on to the discussion. Senator Titus.
Thank you, Mr. Chair. I will be a no on this bill. I appreciate the sponsors' amendments, and however, I think there's many things in this bill that deserve further discussion, but I also want to make sure that I go on record, even though I'm being a no on this bill. I certainly appreciate and accept and encourage individual woman or family to IVF. So in no way is my no vote saying that I do not support IVF, but the bill is what I don't support. Thank you.
Thank you, Senator Titus. Any other discussion? Senator Stone.
Thank you, Mr. Chairman. I'll just simply ditto what my colleague had to say. The most troubling part for me was the definition of human life. So I support IVF and women's access to it, and appreciate your allowing me to explain my no vote.
Thank you so much. Any other discussion? Moving on to the vote. All those in favor, please say aye. Aye. Any opposed? We have 2 nays from Senator Titus and Senator Stone. The motion's carried, and I will go ahead and assign that floor statement to Senator Canizaro. Let's move on to Senate Bill 281. Ms. Cooper.
Destiny Cooper for the record. Senate Bill 281 revises provisions relating to foster care. It's sponsored by Senator Nguyen and was heard on April 3rd. Senator Nguyen proposed the following amendment, which I will not read the original language since it replaces the current language, and it essentially requests an appropriation and establishes a program, and the details are attached.
Thank you so much, Ms. Cooper. Any questions on the bill? Seeing none, I'll take a motion to amend the do pass. We have a motion from Senator Titus. Do I have a second? Second from Senator Lang. Any discussion on this bill? Seeing none, all those in favor, please say aye. Aye. Any opposed? Motion's carried, and I will go ahead and assign a floor statement to Senator Nguyen. Let's move on to Senate Bill 312. Ms. Cooper.
Thank you, Chair. Senate Bill 312 enacts provisions relating to the health of American Indians, Alaska Natives, and Native Hawaiians. It's sponsored by the Senate Committee on Health and Human Services on behalf of the Joint Interim Standing Committee on Health and Human Services. It was heard on March 27th. Senate Bill 312 recreates the Tribal Health Authority Council and sets forth its membership and duties. Additionally, SB 312 requires the Director of the Department of Health and Human Services to collaborate with the Tribal Health Authority during the 2025-2026 interim. Lastly, this bill appropriates $224,000 from the State General Fund to the Department of Native American Affairs for personnel and operating costs of the council. Senator Donyate proposed a conceptual amendment. Among other items, the amendment does the following. It makes various changes to the membership and operation of the council. It grants the council 2 bill draft requests and makes certain provisions related to presumptive eligibility. Thank you.
Thank you so much, Ms. Cooper. Any discussion or questions? Sorry, questions first. Comment. Senator Titus.
Thank you, Mr. Chair. I just want to acknowledge how hard I sat on that interim committee with you, and I certainly think this is long overdue to recognize the tribal health needs in our state. So thank you for bringing this forward.
Thank you so much. Any other discussion or questions? I'll go ahead and take a motion to amend and do pass this bill. We have a motion from Vice Chair Nguyen. Vice Chair Taylor, do we have a second? Second from Senator Lang. Any discussions on this? I will go ahead and call for the vote. All those in favor, please say aye. Aye. Any opposed? The motion's carried, and I'll go ahead and take that floor statement. And of course, I just want to say thank you to the folks that helped us work on this bill, and especially Senator Titus's comments for this. Let's move on to Senate Bill 348. Ms. Cooper.
Thank you, Chair. Senate Bill 348 makes revisions relating to healthcare. It's sponsored by Senator Persina, etc. It was heard on March 27th. Senate Bill 348 makes various provisions related to healthcare, and among other items, the bill provides for the licensing and regulation of genetic counselors as providers of healthcare. However, Senator Persina proposed an amendment, which in summary, it's attached. The full amendment is attached. The proposed amendment is intended to focus solely on a one-time increase to the newborn screening fee charged by the State Public Health Laboratory and removes all other provisions. Thank you.
Thank you so much, Ms. Cooper. Committee members, any questions? Senator Titus.
Thank you, Mr. Chair. I'm gonna be a no on this. I may be able to get to a yes ultimately after I look at this amendment. But at this point in time, unfortunately, I'm not going to support this.
Thank you, Senator Titus. And we do have someone to answer questions if there's any questions from the committee members. Any other comments on this bill? Seeing none, I'm going to go ahead and take a motion to amend and do pass. We have a motion from our vice chair and a second from Senator Lang. All those in favor, please say aye. Aye. Any opposed? We have two nays from Senator Titus and Senator Stone. The motion's carried, and now we'll go ahead and assign that floor statement to Senator Persina. Let's move on to Senate Bill 349. Ms. Cooper.
Thank you, Chair. Senate Bill 349 revises provisions relating to anatomical gifts. It's sponsored by Senator Persina and was heard in committee on March 27th. Senate Bill 349 authorizes a procurement organization to transport or arrange for the transportation of the body part or part of a deceased donor for the purposes of facilitating an anatomical gift. Senator Persina proposed the following amendment, which allows an organ procurement organization to transport the body or part of a registered or authorized donor within the state of Nevada only when medical equipment is necessary to preserve or increase the viability of the donation, and states that the county coroner may prescribe procedures for the notification of transport of a body or part of a registered or authorized donor that is within their jurisdiction. Thank you.
Thank you so much. Committee members, any questions? At this time, I'll go ahead and take a motion to amend and do pass. We have a motion from Senator Stone. Do I have a second? Second from Senator Titus. Any discussion? Seeing none, all those in favor, please say aye. Aye. Any opposed? Motion's carried, and I'll go ahead and assign that floor statement to Senator Persina. Let's move on to Senate Bill 378. Ms. Cooper.
Thank you, Chair. Senate Bill 378 makes revisions relating to healthcare. It's sponsored by Senators Doniate, Cruz Crawford, etc. It was heard on April 1st. Senate Bill 378 revises provisions relating to healthcare and, among other provisions, requires a facility owned or operated by or otherwise part of a hospital that is structurally separate from the hospital and provides limited services for the treatment of a medical emergency to be licensed as Independent Center for Emergency Medical Care, or ICEMC. It requires an ICEMC to provide urgent care services during all operating hours and imposes certain requirements related to such urgent care. Senator Doniate proposed a conceptual amendment, and among other items, the amendment does the following. It revises provisions relating to ICEMC licenses, provides that a clinician cannot be required to sign a non-compete and any non-compete agreement for clinicians hired outside the permission specifically granted in the Nevada Revised Statutes. Corporate practice of medicine is unenforceable, and adds patient-facing clinicians to non-competition section. Thank you.
Thank you so much. Any questions on this bill? Seeing none, I'm going to go ahead and take a motion to amend and do pass. We have a motion from Vice Chair Taylor. Do I have a second? Second from Senator Lang. Any discussion on this bill? Senator Titus.
Thank you, Mr. Chair. I know that you have worked very hard with lots of parties to get this to be a better bill that folks in the industry can accept. Unfortunately, with all due respect, and I know that you are trying to improve access, I think it'll do just the opposite. So I'm going to be a no on this bill.
Thank you so much. Any other comments? Senator Stone.
I'll just simply say ditto to my colleague.
Thank you so much. Moving on to the vote. All those in favor, please say aye. Aye. Any opposed? We have a nay from Senator Titus and Senator Stone. The motion's carried, and I will go ahead and take that floor statement. That concludes our work session for today, and so we'll go ahead and move on to our first bill hearing, which is Senate Bill 434, and so I'll go ahead and invite Majority Leader Canizaro to begin, and we'll go ahead and open the hearing.
Thank you and good afternoon, Mr. Chair and members of the Health and Human Services Committee. My name is Nicole Cannizzaro, and I proudly serve as a senator from Senate District 6 in the northwest portion of the Las Vegas Valley and as your Senate Majority Leader. I am very pleased today to present to you Senate Bill 434, which creates a program to award grants to address shortages of providers of healthcare, or what we are calling Centers for Medical Excellence, or CMEs. Alongside with me today, we have down in Las Vegas, with your indulgence, Mr. Chair, Dr. John Packham, the Associate Dean of the University of Nevada, Reno School of Medicine. And I would like to let him give some comments right after my own. Since I was first elected to represent Senate District 6, I have invested my energy in ensuring that the working families of Nevada have access to a better quality of life. I have always believed that means access to affordable and excellent health care. While we have made strides in health care, we still have so much to do, as I know the members of this committee well know. As a mom, a daughter, a wife, and a friend, I have so many stories of healthcare struggles facing the folks in my life and the lives of so many Nevadans. We all, in fact, have these stories. My dad was hilariously funny. I remember him tickling us as kids with mischievous threats of the walking fingers coming to get us. We'd laugh, giggly, rolling laughs, as he delighted in seeing us smile. I can still hear my mom's wide smiling laugh, boisterous in response to his jokes, quips, and antics. I remember him embarrassing us as he loudly sang in public in Italian. I would shy away, turning bright red, thinking of all the people staring at us, him singing beautifully, trying to lure us to dance along, me looking away, loving it, being completely shy, and wishing for folks to stop looking at me. At the same time, how I wish I could hear him one more time. I remember him telling me I could do anything because I was a Cannizzaro. In times of self-doubt, I still hear his words. And I think he honestly and completely believed it. He argued with the hospital to get out the day of my law school graduation. Undeterred, he made it, and I hugged him long and hard. We found out that his cancer had metastasized. The decision was made that he would be able to get better care out of state. He left Las Vegas in the fall to live in New York and receive treatment. A couple of months later, we were told that it had advanced to a significant brain tumor. When I called to tell him I was engaged a few months later, it was hard for him to speak his congratulations, but he was determined to be here in person to celebrate. He flew home to Las Vegas, and we spent time together. He deteriorated very fast. And I still remember the last words he spoke to me. I love you. My story is not unique. It's not unique for so many Nevadans. There is a global recognition that Nevada is behind with respect to access to healthcare services, particularly with respect to provider shortages, expanding healthcare infrastructure, and advancing innovative healthcare models. In our state, these shortages are particularly extreme in all areas of specialized care. When one of our loved ones faces an acute medical crisis, whether it be in the form of a cancer diagnosis, heart disease, a diagnosis of Alzheimer's or other life-changing or threatening diseases, we are often faced with a dire decision on whether to stay in Nevada, where we have insufficient numbers of medical specialists, or to leave, if we can afford to seek care away from home. This is simply unacceptable, and I believe that it is time that we take action. Currently, 71.9% of healthcare occupations in Clark County, 60.7% of healthcare occupations in Washoe County, and 82% of healthcare occupations in Nevada's rural counties are below the national average of the concentration of professionals compared to the number of Nevadans. In simple terms, we are behind in every area of the state when it comes to the number of healthcare professionals needed to support all Nevadans. Nevada ranks 45th in the United States for active physicians per 100,000 population, 48th for primary care physicians, and 49th for general physicians. Currently, in 33 of 39 specialty areas, per capita rates in Nevada are below the national average, including radiation oncology, cardiovascular disease, and neurological surgery. And in 25 of 39 specialty areas, the number of physicians has not kept pace with the population growth over the past decade. For example, while cancer is the second leading cause of death in Nevada, Nevada faces a critical shortage of oncologists, with fewer than 10 specialists per 100,000 residents aged 55 and older, representing the lowest density in the nation. Existing programs have not fully addressed these gaps, and Senate Bill 434 introduces the statewide healthcare access and recruitment grant program to provide financial incentives for healthcare access and healthcare workforce expansion. Not only do we need to address the shortages of healthcare providers we face, but we want to attract the best and the brightest in the nation. As a generational investment in healthcare, Senate Bill 434 sets out to address the challenges we face as a state with a mechanism that incentivizes the emergence of centers of medical excellence to establish a complete healthcare system that Nevada simply deserves. With your permission, Mr. Chair, I would like to just go through section by section of the bill and give a brief overview. Sections 2 through 7 establish key definitions, including certified area of need, such as a region of the state with a provider shortage or a lack of clinical services, expertise, or providers for a specific healthcare profession. Section 8 creates the statewide healthcare access and recruitment grant program account within the state general fund to support the program. The account will be funded, as proposed in the bill, with a $50 million general fund appropriation for the upcoming biennium. While I recognize that this is not a money committee, and I also recognize that we are having many conversations about how it is that we are investing state dollars and to what extent those state dollars may be available, I do believe that this idea deserves consideration on the policy side. I want to touch on a few of the fiscal pieces and know that we are working through all of those pieces of this piece of legislation. I think that it is worth noting in particular that moving forward, this account will be funded through a different mechanism other than an allocation of just general fund dollars. Under current law, 1% of the total anticipated revenue for the fiscal year is deposited into the Rainy Day Fund. Senate Bill 434 proposes to divert 0.5% of these anticipated revenues to fund these critical grants. Recognizing that we need to ensure budget stability while prioritizing healthcare workforce expansion, there are several safeguards built into Senate Bill 434 to ensure that these transfers occur only during times of relative financial certainty for the state. First, the transfer would not occur if the account has a balance of $60 million or more and would only be carried out once the balance decreases to less than $30 million. Additionally, the conceptual amendment that we have provided today would prevent the state controller from making a transfer if the balance of the Rainy Day Fund is less than $1 billion. Section 9 requires the Department of Health and Human Services to conduct a statewide healthcare workforce assessment every 2 years to identify provider shortages. This study will evaluate geographic and specialty-specific shortages and unmet needs in medical services and will be a critical component in determining the best use of funds awarded under this grant program. Also included in the conceptual amendment is a provision allowing DHHS to utilize existing assessments for the first report due July 1st of 2026. Sections 10 and 11 establish the grant program and prescribe the application process for the grant program. Eligible entities include healthcare providers, educational institutions, and nonprofits, just to name a few. Section 10 also establishes requirements that projects must abide by to maintain eligibility, such as addressing certified provider shortages, securing matching funds at least equal to the grant amount, demonstrating financial sustainability beyond the grant period. Sections 12 and 13 also require the Department of Health and Human Services to review the applications and make recommendations to the Interim Finance Committee for funding. Priority will be given to projects with the highest impact on underserved areas. Sections 14 and 15 require grant recipients to sign funding agreements outlining project goals and reporting requirements. DHHS will also be granted the authority to modify, suspend, or terminate funding for projects that fail to meet milestones or become inactive. Sections 16 through 18 established accountability and oversight provisions for the grant program, including audits and site visits from DHHS, revocation or repayment of funding for noncompliance with the grant agreement, and final reporting requirements, as well as a follow-up report a decade after project completion. Sections 19 and 20 make conforming changes to the existing law on rainy day transfers to reflect the new funding mechanism established in Section 8. I believe that Senate Bill 434 represents a significant step towards strengthening Nevada's healthcare workforce. By allocating funds both strategically and ensuring oversight, the bill aims to address long-standing provider shortages and improve healthcare access statewide. With your permission, Mr. Chair, what I would like to do is to turn the presentation over to Dr. Peckham, who is down in Las Vegas and joining us via the video. And then we'd love to take any questions that you or the committee may have.
Thank you, Senator, and good afternoon, Chair Donyate and committee members. For the record, I am John Packham. I serve as Associate Dean for the Office of Statewide Initiatives and am co-director of the Nevada Health Workforce Research Center based at the UNR School of Medicine. Over the past 25 years, my office and research team have published 100+ reports and publications, including recently the Nevada Rural and Frontier Health Data Book and a recently released Nevada Workforce in Nevada report. Most of that research has focused on health workforce supply and demand in Nevada, as well as state policy measures to address workforce shortages. Just a few general comments then on workforce supply and demand, and again, happy to take questions as this hearing proceeds. First, the good news. For the past decade, we've seen a steady growth in the number of licensed professionals, including licensed physicians, registered nurses, and other health professionals. Nevada is an attractive place to live and work, and that's borne out by the steady increase of health workers from other states and even countries. However, I would say that what we've also seen is what I would call a treading water effect in per capita growth of licensees. That is to say, while we've seen modest gains in licensees, when we adjust that for the state's rapid population growth, we see a more level trend. In other professions such as psychiatry, clinical psychology, and other behavioral health professions, per capita growth has actually been flat. Another major supply-related trend is increasing aging of the workforce, serving an aging population. So, for example, the average age of a physician is 55 years and has been increasing in most medical specialties, and nearly 30% of the licensed physician workforce is over the age of 65. A final enduring feature of our state's workforce supply and trends in our workforce supply is the geographic maldistribution of the health workforce, which is another way of saying there are uneven shortages of provider in rural versus urban areas of the state, and within urban areas severely under underserved populations in both southern and northern Nevada. Now, when I flip the discussion to health workforce demand, in the most general terms, the principal drivers of health workforce in demand are demographic and economic in nature. For the past 2 decades, Nevada has been one of the fastest growing states in the country. In addition to rapid population growth, particularly in southern Nevada, our state's population is aging. Over the next decade, the Nevada population is projected to increase by nearly 300,000 residents. The population over the age of 65 is projected to increase by 120,000, or 26%. All things being equal, these demographic forces will drive additional demand for care. Economic growth and the growth of decent paying jobs represents another major driver of health workforce demand. Up in northern Nevada, I refer to that driver as the Tesla effect. In the case of the Tesla Gigafactory, we've seen 7,000 plus new jobs added to the local economy, jobs with an average wage of over $60 per hour, $60 per hour that is, and comprehensive health benefits. And again, it's a double-edged sword. We welcome and want to see economic growth, but with that growth comes increased demand for health services and health workers. The final demand driver that I would mention is the growing demand for chronic disease and treatment and management, diabetes, cancer, cardiovascular disease, as well as a number of age-related demand for care that is driven again by an aging population in Nevada. In closing, there's a number of policy measures at the state level we can take to, as I like to say, move the needle on workforce shortages in our state. I tend to think of those in kind of 3 general broad buckets. The first is grow your own strategies. There's no substitute in our state for increasing the supply of health professionals and making sure they stay here is by expanding opportunities for students, residents of the state, building those programs that prepare Nevada kids, I call them kids, for licensure in the state of Nevada. The second bucket is efforts we can take to stretch the existing workforce. That is to say, we don't necessarily need in every instance to increase the supply of health professionals. We need to make better use of them, and we can do that through measures such as greater utilization of nurse practitioners and PAs and support staff and team-based models of care. The third bucket is a diverse set of strategies that recruit and retain healthcare workers from other states and in some cases other countries. You're looking at a lot of measures, more compact bills this session than I can count. I would include those in those buckets, but I would also point to measures that this legislature has taken in previous sessions to expand loan repayment for health professionals. It is a fantastic way, particularly in rural areas of the state, to match needs in those communities with health professionals who are willing to provide service in those communities in exchange for loan repayment. I'll conclude by just noting a Chinese proverb that crystallizes my thoughts on health workforce development in the state. That proverb states, quote, "The best time to plant a tree was 20 years ago. The second best time is today." In conclusion, I contend that SB 434 represents one of those grow your own policy measures that stands to move the needle on provider shortages. Senator Cannizzaro.
Nicole Cannizzaro, Senate District 6. Mr. Chair, that does round out our presentation. Just, I think you've heard from Dr. Packham about some of the need and why that is so critical that we start to take some of these steps now. I'd be happy to, along with anything that maybe that Dr. Packham can answer as well, to entertain any questions that you or the committee members may have.
Thank you so much, Majority Leader, and of course, thank you for sharing your story to all of us. Committee members, do we have any questions? Let's start with Senator Titus.
Thank you, Mr. Chair, and I know that was tough to present. It clearly is something near and dear to your heart that remains in your heart, and our parents are very important to us. So having said that, however, Mr. Peckham down in the south there, Dr. Peckham, everything you just testified to, and I use your Nevada Health Report book, and I pulled out a copy of that just yesterday when I was researching something. And everything that you've said about where our healthcare needs sounds like we already have done that. And so what I'm worried about, this is duplicative of some of our efforts, and perhaps the funding is better used for GME and some of the other programs that we've already identified that we need. And I worry about yet another committee or advisor committee or another study when we, I think, have documents very thick of studies and studies and studies. And now it's about trying to make a difference and fill these spots. So can you explain, maybe John or Dr. Peckham, all the years we've talked about these studies that you produce so well, how this truly will be different? Because I'm not quite there.
Thank you for that question. John Packham again for the record. My response to that in pointing out those policy measures that I just mentioned, the three buckets or sets of measures we can take, is that we know what works, but that there's still plenty of unfinished business, to put it mildly. My big concern in the state of Nevada is we've made progress in growing the physician workforce. We've made progress in growing the nursing workforce through expanded public support for those programs, but we're barely keeping pace with population growth. We're also need to be mindful of the fact that folks are exiting the health workforce just as folks in the general community are approaching retirement age. A couple of things that I really like about this bill that I think stands apart from a lot of, honestly, policy measures enacted by the legislature is that it sets up a grant program that demands applicants track progress in, quote unquote, moving the needle on those provider shortages. The state's not just saying, here's a couple of $1 million to address this or that shortage, good luck. They're demanding that you demonstrate progress in moving the needle on those provider shortages. Equally important, and you rarely see this in state or federal grant programs, it's also asking applicants and eligible applicants to tell you what they are doing and to improve the health of the population. So be it primary care, cancer care, behavioral health care, if we're going to improve population health outcomes in the state, at a minimum, we're going to need a stronger, more resilient healthcare workforce. But that's part of the solution. There's other measures, public health measures, you'll hear about later today. But workforce is a critical part of that issue. I was in Ely, Nevada last week and talking with the administrator there. And he's got 12 open nursing positions. and every time I visit him, he's got 8 to 10 or 12 open nursing positions. That's one tiny hospital in rural Nevada, extended across the state again. And I hope I am not dodging your question, but there's plenty of unfinished business.
Any other questions? Senator Stone.
Thank you, Madam Majority Leader, for your personal story. I have a similar personal story. My mom had breast cancer at 57 years old. We had to take her to MD Anderson in Texas to try to find a cure for her. Unfortunately, she succumbed at 57 years old. So I can relate, and I know that you and I both have a similar passion for wanting to bring different groups of medical care that we need here in Nevada, but especially oncology care. We've got cancer centers that are here in Las Vegas that do an outstanding job. I've always said the competition is good, and we need to bring in more competition. We need pediatric neurologists, pediatric oncologists, there's a whole gamut. And I think that this bill is a brilliant attempt to ensure that we have a steady stream of funding and to make sure that we recruit the professionals that we need here in the state of Nevada. So thank you for that. Thank you. I think it's just a brilliantly written bill. I just want you to talk a little bit about the funding source, which is 0.5% of the general fund. And if it gets to $60 million max, that's when it stops. And then, if my understanding is right, if it falls below $30 million, then it replenishes again. And so if you could just confirm that, and there's no reversion of funds that's going to go back into the general fund, except within those parameters. And maybe just talk a little bit about the IFC process to make sure that we're really narrowing down the professions that we need here and their ability to choose and select what we're going to achieve.
Thank you so much for those questions, Senator Stone. Through you, Mr. Chair, to Senator Stone. And first, I appreciate you sharing your story. I think it's always tough when you're faced with that human and personal component of someone that you love who is trying to find the care that they need. And I think in the context of all the discussions that we have had, even since my time in this legislative building, of how it is that we are going to invest more in GME, how it is that we are going to grow our nursing, nursing student capacity, bringing on the UNLV medical school, making sure that we're investing and continuing to invest in the programs up at UNR for our medical school, and doing so many other of the healthcare pieces, that I think we have to think about how we are being innovative in attracting and bringing in some of these more specialized areas of care. And I think that Dr. Packham's testimony truly does speak to that we have to be focused on what it is we can do, and what this bill really endeavored to do was to try to figure out a way where we can have some funding sources that are not just money that we're setting aside, hoping that something comes forward and is able to be done. I think that there's merit to that. There are obviously a lot of bills around here that have appropriations for things, but I think that any way that we can both make sure that we're focusing and we are dialed in on what the needs of our communities are, incentivizing and being able to help those entities make those steps, because in the end, it sort of benefits not just us seeking care for loved ones, but us also being able to fill GME spots and increased residencies and increased innovation in technology and science that is coming and helping to sort of build what I really truly believe could be sort of this much more comprehensive healthcare infrastructure. I think that's what we were trying to do with this, right? And so we started to figure out what would that funding mechanism look like, what could it look like, and obviously we'll have the financial, fiscal conversations on the money committees, which I know several people on this committee also serve on, and there is definitely an appropriation in this bill, which we are cognizant of. But I think the other piece of this is, how do we make sure that we can incentivize that in a way that is not detrimental to the state. And so through this whole process, what has come before you now is Senate Bill 434. So first and foremost, there are parameters around this, right, that are designed to have us really take a look at where our community needs are, where those specialized needs are, before this money would be available. In terms of the ongoing funding, you are correct that there are parameters within statute that trigger advances from the general fund into what we call the rainy day account, sort of a savings account for the state. We put parameters around that to ensure that we were not draining the rainy day account, that this account was not just sitting with no money in it, or that it was accumulating excessive amounts of money over time that were never, even though they might not be used, it was still continuing to accumulate money. And so that's where you see those parameters. Under current law, 1% of the anticipated revenue for the next fiscal year is deposited into the rainy day fund. There's a trigger for that within statute. Senate Bill 434 says that if there is over $1 billion in the rainy day fund, then you would have, and that's through the conceptual amendment, I should note, then you would have 0.5% go into this fund for the healthcare workforce. It would not occur again if the balance in that account was 60 million or more, and would only be carried out once the balance decreases to less than 30 million. And so those are just sort of the floors and the ceilings, if you will, for the account to ensure that there is sufficient money to allow for these grants to occur. It provides a funding mechanism that is triggered in times where the state would have sufficient funding to be able to do that, and that would not unnecessarily drain or keep monies from the rainy day account. And so that's what's proposed in this bill. What is also proposed in this is that there would be applications and review within this legislative body. I think it is incumbent upon us, if we are taking on the task of saying this is a problem that we want to solve, that we be involved in what it is that we are trying to do to solve those problems. I think a lot of the times what happens is we'll pass a bill in a legislative session, it will go into law, and we have all seen it where it happened several sessions ago, it is still there, we're not really sure what that law is doing, no one is keeping good accounts on it, or we wish that we had some more oversight, or we have opinions about that, and there's no mechanism for the legislature as a body and as an oversight body and as a body that is in charge of appropriations to be able to have that capability. And so what is present in Senate Bill 434 is a mechanism for IFC to be able to review those applications and to be involved in that oversight process so that we can be flexible and make adjustments if we come back into a legislative session after an interim in IFC and it's not working, or we need to make some different tweaks so that we're not sitting here with $50 million sitting in an account and nobody used it and we don't know why. I wanted to avoid that as much as possible, and so that's why you see some of those parameters in the bill in sort of the biggest general foot view of why it is that there are parameters in there for IFC.
Thank you for answering the questions, and thank you for bringing the bill forward.
Senator Lang.
Senator Canizaro, thank you so much. This means a lot to me as well. And I'm going to not try to cry, but it's been really important to me. My father died at 48 of cancer because he couldn't get the care he needed. So every session that I've been here, I've run a cancer bill. My question to you is how, I understand the money part and how that plays into this, but how can we quantify the number of people that we can get into the field? Because it's good to pass bills where you can do early detection and get rid of step therapy and all that kind of stuff. But unless you have the people, the physicians that can take care of that, sometimes we get stuck in a hole. And so how can you have an estimate or a guesstimate about how long it would take for us to get people active and on the ground? And I'm sure it'll take a few years, but do you have any idea about that?
Thank you for the question, Senator Lang, through you, Mr. Chair, to Senator Lang, Nicole Canizaro, Senate District 6. So I think a little bit inherent in your question is some of what plagues us, and I think to Dr. Peckham's last point about, when is it that you plant the tree? If the best time was 20 years ago, but today is the next best time, then today is when we should act. Some of this is not a bill that is going to fix every problem in healthcare in the state of Nevada overnight. But part of, I think, the study pieces, and I will also reserve time in case Dr. Packham has any thoughts on this as well. But part of the reasons why we wanted to make sure that there was a study going into the provider pieces, where it is we would provide the greatest benefit, how many people we would really be able to serve, why we're talking about some of these specialized care, is to hopefully target the resources in the bill to really bring those providers on board, or help providers that are currently serving here that need some additional capacity to be able to bring on those specialized care services, to really allow for that to happen. I think that part of it is a little bit of a chicken and the egg, that we can't say, well, we don't have any of the providers, so we shouldn't be working towards building out some of the infrastructure or providing some spaces to sort of increase these types of care centers. But we can't wait for one to occur without the other, right? We have to sort of have that infrastructure in order to get the practitioners and the physicians and the specialists here to then do and engage in those practices. But I think that that's why within Senate Bill 434 in particular, Section 9 talks a little bit about this study to help us try to identify where those needs are, to hopefully help us target some of the folks who might be interested in working through our centers of medical excellence pieces to get some of the infrastructure spend, to bring them here. That I think we have to sort of do those two things at the same time. Like, yes, we have to invest in making sure that we are bringing in the workforce that is going to accompany this. In companionship with that, there are studies and really, I think, thoughtful pieces in here to make sure that we are doing just that, and the review process on the back end to make sure that that is happening as well. But I also think that some of that is going to come just by function of bringing some of these centers of medical excellence on board. And so I don't know if Dr. Packham has anything else to add specifically, but I do think that this is really the question for this committee and the question for this legislature is, if we aren't going to do this now, when are we going to do it? Because there is no overnight fix to this. We have to start thinking very thoughtfully about how it is that we build this in order to bring on that workforce.
Any other questions? I just had a quick one from Mr. Packham. It's I just want to start off. It's interesting because every time I talk to him, he's always up here and I'm down there. So it's a little bit of the reverse today. Just as a recommendation for this, one of the things that I've looked at, especially in terms of when we build new medical facilities, is what I have a fear is folks are going to come to us and say, we're solving a shortage. And then the first thing they do is they build in Summerlin. And so we've seen that several times, of course, where there's a promise of actually building access to care, but they don't follow up on it. And so I want to make sure that the facilities that receive this grant funding are actually dedicated to serving those high needed areas. And so, Mr. Packham, Dr. Packham, I don't know if there's a recommendation of, like, if you are a facility and you're asking for construction funds dedicated to opening up or standing up this facility, that you have to be located in a high Medicaid dense area, or I think the public health term that we use as HPCA SA. So it's right the areas designated with the primary care shortages and so forth. So I don't know if that's a metric that you have considered as part of this legislation of, like, we're only going to be focusing on the areas of the highest, greatest need of where these facilities are standing up. So it's not just the services they're providing, right? Because we don't want folks to go out of state for care, but they also have to have an onus of developing these centers or these facilities in the areas of highest need, not where there's a lot of commercial insured patients, right? So I don't know if you can speak to that, if there is a metric that we should follow, or if you took that into consideration.
Yeah, thank you for the question, John Packham, for the record. A couple of real quick observations on, as you think about what this grant program will look like as it's rolled out, you'd want to be doing two things. One, addressing community-wide needs. From everything we've heard today, cancer care, access to cancer care is a community-wide need in Las Vegas, Reno, and the rest of the state. The second thing is, I do think, and kind of the way the bill's written in its current form, is that it gives the program the ability to target in smaller areas of need within the state. I will let the Primary Care Association speak for itself, but I know that they have been hungry for dollars to stand up graduate medical education in outpatient settings in the communities that they serve. I think that the grant program holds the great potential to hear innovative ideas that none of us have considered yet, but want for dollars they are prepared to roll out. A second observation that I wanted to make with respect to how long would this take? The technical answer is a long time in some cases. But I would point out that I think there's a real opportunity right now in the state of Nevada, and that is we've seen the expansion of undergraduate medical education over the past decade. We've seen the slow but steady expansion of graduate medical education opportunities. But what I've seen in an annual survey that my office conducts, we interview every resident and fellow completing their training in Nevada. We lose 25% of those docs, newly minted GME grads, because there are not fellowship opportunities in oncology, cardiovascular disease, and so forth that exist in the state. We have some of those programs, particularly in southern Nevada, but they're full. and our grads are leaving with no guarantee that they will come back to Nevada when they've received that specialty and subspecialty training. So an immediate undertaking or activity could be as simple as expanding those fellowship opportunities. That won't take 7 to 10 years. That can be done pretty quickly, particularly if those programs are already accredited.
And Mr. Chair, if I may, Nicole Canizaro, Senate District 6. So a couple of pieces that I wanted to just point the community to within the bill. In Section 9(2)B, there is, in fact, as part of the study to identify where needs exist, it includes determinations of most critical shortages in healthcare workforce that prioritizes, in particular, under subsection 2, geographic areas of the state that are experiencing the most critical shortages of providers of healthcare. And so there are intentional pieces of this that are designed to first, help us to identify those areas. And then within the grant process itself, where it talks about the eligibility for entities for applying for a grant from the program in Section 10, subsection 2. There are a list of other, of some of those pieces, but it does in fact talk about where we have, where those particular programs then fall and meet those grant qualifications. And so I think throughout the application pieces, and then in Section 12, where it talks about reviewing, the department reviewing applications to determine where it is that the funding should go, it does talk about applicants in recommending the funding to give priority to some of these areas. In the conceptual amendment as well, within Section 12, you'll see that there are pieces in here that are trying to give recommendations of priority for places that are coming in to meet unmet needs and that are going to provide those greatest benefits. And so I think when you read all of those pieces in conjunction, the entities that are eligible to apply for these grant funds in conjunction with the study that is sort of helping us to identify where we do have unmet areas of need, where it is that we may want to retain specialists, giving particularized attention, of course, in part of that subsection to the geographical needs, but then on the grant application side and in terms of giving priority, making sure that we are prioritizing those projects that really are going to bring in new and innovative areas and are really going to address some of those things. And so the language within Senate Bill 434 was very particular in making sure that we weren't just sort of setting aside a pot of money to just do something that is maybe that we are already doing very well. It really is meant to help to expand and to help focus on where we have unmet needs in geographical areas and within certain specialties. So it sort of gives, I think, consideration to both of those things.
Thank you so much. Any other questions? Senator Lang.
So just a comment. So in Senate District 7, there's an empty hospital, and I'm sure we'd meet the criteria for a grant.
Thank you, Senator Lang, for advocating for your district. I'm sure we all have plenty of locations. All right, I think we concluded our questions, so we'll go ahead and open up for testimony. Because, of course, we're in a shortage of time today, and we're in deadline week. It's 15-15-15 for all the bills. It's the same thing we've done the last 2 weeks. So let's bring it up for folks who are in support, both in Southern Nevada and in Northern Nevada. I'm going to do a few here in Carson City, and then we'll go down south, and then we'll go online. So you may begin.
I'm Dr. Joseph Alvarez. Committee Chair Donante and members of this Senate committee, I am Joseph Alvarez. I'm a professor in the Department of Hematology at City of Hope Comprehensive Cancer Center. I testify today in support of SB 434, and I want to thank and recognize Senate Majority Leader Canizaro for her leadership on this important legislation. American Cancer Society researchers predict that in 2025, Nevadans will experience 17,500 new cancer diagnoses and more than 5,400 cancer-related deaths. Unfortunately, Nevadans will be challenged to provide care for these patients. The Nevada Cancer Plan identified significant gaps in the number of oncologists, specialized physicians, advanced practice nurses, oncology navigators, and in patient access to palliative care and clinical trials. Many Nevadans have to travel outside of state to receive advanced care technologies or potentially life-saving clinical trials. This includes patients who need CAR T cells, blood stem cell transplants, complex lung cancer surgery. For example, 40% of Nevadans with myeloma have to travel outside of state for a portion of their care. With SB 434, there is cause for hope. This bill will address shortages of needed healthcare providers and create centers of medical excellence to keep up with the rapidly evolving cancer advancements such as genomics or cellular therapeutics, targeted therapies. City of Hope would welcome the opportunity to come to Nevada and would look to partner with oncologists and physicians in this state to better meet the needs of Nevadans here, closer to home. A significant added benefit of this would be the ability to create the nucleus for a biotechnology center that will encourage collaboration between community physicians, academic institutions, biotechnology companies, and expand the healthcare ecosystem to spur on new and greater investments. We believe that there will be great opportunities for biotechnology to advance with significant economic benefits to the state. For this reason, I urge you on behalf of City of Hope to support SB 434. Thank you.
Good afternoon, Chair Doniate, Vice Chair Taylor, and members of the committee. My name is Drianna Dimatulak, Drianna Dimatulac. I'm with Brownstein on behalf of the Immigrant Home Foundation in strong support of SB 434. We'd like to thank Majority Leader Canizaro for bringing forward this vital and innovative piece of legislation, which addresses one of Nevada's most pressing challenges, the shortage of healthcare providers. SB 434 would provide essential grants to programs that help close this gap, such as the Immigrant Home Foundation's in-house psychological services program. Through this initiative, we've been able to offer trauma-informed therapy and psychological evaluations to survivors of domestic violence and other serious crimes. SB 434 would give us and other programs an opportunity to apply for funding so we can continue these critical mental health services to some of our state's most vulnerable residents. For these reasons, we respectfully urge your support for SB 434. Thank you.
Chair Doniate, members of the committee, Connor Kane, CONNOR, CAIN, in support of Senate Bill 434 on behalf of HCA Healthcare, which includes our state's largest safety net hospital, Sunrise Hospital and Sunrise Children's Hospital. We appreciate this bill's consideration for taking care of underserved populations and the comments made by the sponsor and your comments, Chair Doniate, for facilities located in areas of highest need. Sunrise Hospital and Sunrise Children's Hospital is incredibly proud to provide care to more Medicaid patients than any other facility in the state. We also think oversight, which is contemplated in this legislation, is incredibly important. Sunrise Children's Hospital provides unique services that aren't available anywhere else in Nevada, some of which have outcomes better than any other facilities west of the Mississippi River, including academic medical centers in neighboring states such as California. We're excited about the opportunity to do more with SB 434 to serve our community and appreciate Majority Leader Canizaro for telling her story and bringing this bill. Thank you.
Association. Okay. Nevada has a healthcare workforce shortage, and we support efforts to grow it. We want to thank the sponsor for developing a strategic and analytics-based funding program to address the issue. Thank you.
Let's take a quick pause and go to Las Vegas, please.
Good afternoon, esteemed members of the Committee on Health and Human Services. I'm Paul Dieter, Executive Director of Comprehensive Cancer Centers of Nevada. I'm here to support the bill of Senate Bill 434, creating a statewide healthcare access and recruitment grant program, and agree with the challenges the Senate Majority Leader noted, and we offer sympathy for her loss. This initiative addresses critical shortages of healthcare providers in Nevada. For over 40 years, comprehensive cancer has been pivotal in providing top-tier oncology care in Nevada. Our established relationships and infrastructure position us to significantly impact care through residencies, fellowships, and clinical trials, making us ready to partner. Our research program, active for over 20 years, conducts over 150 trials annually and is nationally recognized. Our strategic vision aligns with Senate Bill 434. We identified a need in an underserved area in the medical district to reduce travel for patients and will open next year. We're on track for our goal of adding 10 additional oncologists between this year and next year, well over half of the way there. And we're committed to matching any grants received, ensuring long-term sustainability. SB 434 provides a framework to meet Nevada's healthcare challenges, and we're happy to be here in support and to partner in any way. Thank you for your time.
Chair, members of the committee, Samantha Barnes on behalf of Roseman University of Health Sciences. We'd like to thank the Majority Leader for bringing this piece of legislation forward as we offer programs in nursing, pharmacy, dentistry, and will admit our first class of 60 medical students this summer. We are here today in full support. Thank you.
Thank you so much. Anyone else in Las Vegas? AVH, let's do 3 online, please.
To testify in support, please press star 9 on your phone to take your place in the queue.
Good evening, Chair Doniate and members of the committee. This is Benjamin Challinor, BenjaminChallinor, Nevada Director of Public Policy for the Alzheimer's Association. On behalf of the nearly 55,000 Nevadans living with Alzheimer's and dementia, we are in strong support of Senate Bill 434. This bill cannot come at a more crucial time to make sure we meet the needs of Nevadans living with dementia. According to the 2024 Alzheimer's Association facts and figures, there are only 43 specialists in Nevada that meet the needs for Alzheimer's and dementia. Nevada is, as we describe, as a dementia neurology desert, meaning that we have fewer than 10 specialists per 10,000 Nevadans living with dementia, we are one of 20 states. As a result of this, we are seeing folks waiting in excess of 6 months to a year to be able to get into a specialist after receiving a referral. The wait time can be detrimental to one's treatment, especially with now there being 2 FDA-approved treatments that actually treat the disease. But this treatment is only available for those who receive an accurate and timely diagnosis, as it is for early-stage dementia and Alzheimer's. We believe that this bill will help bridge this gap, making sure that we are able to meet these needs for Nevadans. Thank you.
Thank you, Chair Doniate and members of the committee. My name is Stephen Messenger. That's Messinger for the Nevada Primary Care Association. We represent the state's federally qualified health centers. We hear every day from our members the challenges of attracting and retaining a healthcare workforce. To address this, NVPCA is focused on supporting any effort that helps the state grow its own workforce, and we believe that SB 434 makes a bold investment in these efforts. We're grateful to the Majority Leader for bringing this bill, and we support it. Thank you.
Good afternoon, Mr. Chair, members of the committee, Stephen Cohen for the record. Thank you, I yield.
Chair, there are no more callers in support at this time.
Thank you so much. Let's come back to Carson City, please.
Thank you, Chair. Sheila Bray, Government and Community Engagement with the University of Nevada, Reno. We just want to say thank you to the Majority Leader for bringing this bill and allowing us to co-present with her, and we're in full support. Thank you.
Thank you, Chair and members of the committee. Blaine Osborne, Nevada Rural Hospital Partners for the record. Healthcare workforce is the most serious challenge that our critical access hospitals face. We need more doctors, nurses, CNAs, lab techs, rad techs, social workers, mental health professionals. We need more everybody. We want to thank Senate Majority Leader Canizaro for this bill and are thrilled to be here in support. Thank you.
Thank you, Chair Doniate, Vice Chair Taylor, members of the committee. My name is Devin Ashoff, DEVENASCHOFF, up here speaking on behalf of Toro University, Nevada, in support of SB 434. At Toro University, we are deeply committed to advancing the healthcare workforce and driving innovative research that saves lives. Notably, under the leadership of our Dr. Aurelio Larico, our faculty are conducting groundbreaking cancer research. At Toro, we believe we are on the verge of understanding how to prevent cancer from metastasizing, a discovery that has the potential to change the lives of countless patients and families, not just in Nevada, but across the country. Investment in healthcare workforce development, as this bill aims to do, is vital in ensuring that these kinds of life-saving advancements reach the communities that need them the most. We would like to sincerely thank the bill's sponsor for bringing this legislation forward, urge the committee to support it, and thank you for your time and consideration. Thank you.
Good afternoon, Chair Janate, members of the committee, Joanna Jacob, JACOB, on behalf of Clark County. I've been here before you talking about the challenges with our child welfare system and the system serving our kids. One of those barriers has really been funding, sustainable funding, things that help grow capacity for that system, and staffing. Because of this bill, I think that this is a great investment and could really serve our system as well, especially as we are struggling to find services for our kids in our systems. So for that reason, thank you, Senator Canizero, for this very smart approach, and we are in support. Thank you.
Good afternoon, Chair and Committee. My name is Sabrina Schnur, Sabrina Schnur, and I'm here today on behalf of the Nevada Public Health Association, and PHA is in full support. Thank you.
Good afternoon, Chair Doñate and members of the committee. My name is Charlie De La Paz, CharlieDelapaz, on behalf of the Nevada Nurses Association. We are in support of SB 434. This bill takes an important step toward addressing our healthcare workforce shortage, especially in underserved areas. We believe SB 434 is a smart and proactive investment in improving healthcare for all Nevadans, and we are grateful to the Majority Leader as well. Thank you.
Thank you, Chair Regan Comis, REGANCOMIS, here today representing the Lou Ruvo Center for Brain Health. And in the interest of time, we'll just say we're here in support. Thank you.
Hello, Amy Hines Sutherland, AMYHYNE-SUTHERLAND. I'm here on behalf of the Nevada Association of Counties. Thank you, Majority Leader Canizero, for introducing this bill. Due to the significant potential for SB 434 to grow our critically needed healthcare workforce across the state, local governments support this bill. Thank you.
Good afternoon, Chair and members of the committee. Jacqueline Nguyen, NGUYN, representing Nevada State Medical Association. We are in strong support. As physicians, our members witness firsthand the increasing strain caused by the growing demand for healthcare services across the state. I will keep this short and just say that we are in full support and thank the Majority Leader for bringing forth this bill.
Thank you, Chair Committee. Russell Rowe here on behalf of the Kirk Kerkorian School of Medicine at UNLV, expressing our strong support. Thank you.
Chair Dan Musgrove, representing the Valley Health System of Hospitals, and I didn't think I'd get emotional today, but thanks to the Majority Leader, I came pretty close because I had myself had a cancer scare this year, and the Valley Health System is exuberantly and passionately behind this bill. Thank you.
Thank you so much. Anyone else in support of this bill? I don't know how we did that so efficiently, but it was pretty good. I think we have like a minute left. I'm going to go ahead and close testimony in support. Anyone in opposition to this bill, please come forward. I don't see anyone here or in Las Vegas. AVH, is there anyone online?
If you'd like to testify in opposition on Senate Bill 434, please press star 9 on your phone to take your place in the queue.
Good afternoon. CYRUS HOJJATY. I stand in opposition. I will ditto the future callers. If you look at the Nellis polls, it has almost 100% opposition. So hopefully we can address it. But I do appreciate that healthcare is being addressed. I will say there are some parts that I do appreciate. Thank you. Yield.
Caller with the last 3 digits, 760, please press star 6 to unmute yourself.
Hello, my name is Cynthia Perrine, CYNTHIAPERINE. I want to thank the committee for allowing me to say a few words. This is probably a very good bill. I will say that the intent casts a broad net for dementia, cancer, immigrant care. I'm thinking maybe a smaller, more targeted approach might be better. The cost is high, and it is a reality that voters are concerned these days about government misuse of funds. The bill also calls for a review of its effectiveness. At the back end, I would suggest that it be moved up to be immediately part of this process. So at this point, I would say I oppose this bill, but I am grateful for all the work that has gone into addressing the needs of Nevadans' healthcare. Thank you.
Chair, there are no more callers in opposition at this time.
Thank you so much. Let's move on to neutral testimony. Is there anyone that would like to testify in neutral? Seeing none here or in Las Vegas AVH, is there anyone online?
Chair, there are no callers in neutral at this time.
Thank you so much. Majority Leader, do you have any closing remarks? All right, we'll go ahead and close this hearing, and thank you so much for joining us. And we will now move on to our next one, which is Senate Bill 423, I believe is what I had next. I'm going to go ahead and open this bill hearing. This bill revises provisions governing public health. It is Public Health Week, and so I'll go ahead and invite our public health folks to present.
Okay. Good afternoon, Chair Dunyate, members of the committee. My name is Dr. Amy Hines-Sutherland, and I serve as the Health and Human Services Manager for the Nevada Association of Counties. During the interim, NACO convened health authority leadership from across the state to work on statewide public health infrastructure development, including efforts to address the need for flexible, sustainable funding, together with the interim Health and Human Services Committee. I'm joined here in Carson City and down south in Las Vegas by representatives from all local health authorities in the state and leadership from the Division of Public and Behavioral Health. The presentation before you today represents a collaborative statewide effort, and each health authority is available to answer your questions as needed. Thank you for the opportunity to present Senate Bill 423, which is focused on building Nevada's local public health infrastructure. Let's begin with some context. In the last legislative session, you passed SB 118, which provided an historic $15 million investment in Nevada's public health system, about a $4.57 per capita investment over the biennium. This flexible funding enabled local health authorities to address their most pressing public health needs and invest in building foundational services. On behalf of all the local health authorities across the state, thank you for that investment, and thank you to the governor and also this body for the recommendation to continue that investment into the next biennium. Today, I'll discuss the impact of SB 118 and the need for SB 423, the bill before you today, through the nationally recognized framework of foundational public health services, or FPHS. The FPHS are the minimum recommended set of governmental public health services every person should have access to, no matter their zip code. This principle is key. Public health must work everywhere if it is to work anywhere. Communicable diseases do not recognize geopolitical boundaries, and a lack of public health infrastructure in any part of our state is a vulnerability to the whole. There are 5 foundational program areas. You can see those on the slide across the top. They are communicable disease control, chronic disease and injury prevention, environmental public health, maternal, child, and family health, and then access to and linkage with clinical care. There are also 8 foundational cross-cutting capabilities. These are the capabilities that ensure effective, efficient, and responsive public health agencies. They are assessment and surveillance, community partnership development, equity, organizational competencies, that's things like IT and HR, or human resources, policy development and support, accountability and performance management, emergency preparedness and response, and of course, critically, communications. On the slide here, you have a snapshot from a dashboard we created. This is a national model, but we can't use the national model's images for the sake of copyright. As required by SB 118, local health authorities assessed the needs in their communities and identified and pursued 36 priorities across Nevada. The top 3 areas of need identified by foundational public health service area were communicable disease control, access to and linkage with clinical care, and mental and behavioral health. I do want to highlight mental and behavioral health is not a nationally recognized FPHS area, but it is a public health priority in the state of Nevada. And so communities did choose to support that through that funding. So next, let's take a look at local examples of how SB 118 funding made an impact. Here is a statewide summary of SB 118 investments by FPHS category. On the following slides for each health authority, we have provided a pie chart demonstrating the investment amount by FPHS area, but I'll focus though on some specific examples of how this investment is positively impacting Nevadans. The Division of Public and Behavioral Health is the lead health authority for 10 of Nevada's counties. How did these funds help DPBH Health Authority counties? You can see here access to and linkage with clinical care was a core priority focus by a number of local jurisdictions, also environmental, public health, and communications. Lyon County, tackle traffic safety, youth mental health and STI prevention through targeted campaigns. White Pine and Lander counties focused on youth dental health and public health outreach in rural areas. Elko County is working to improve local coordination and delivery of environmental public health services. Lincoln County is improving quality of life and access to services for seniors. Douglas County is tackling heart health and HIV prevention, treatment, and training. So something I just want to highlight here is that local needs vary. And so local decision-making and the ability for these funds to be flexible and reflect what a community needs is very important. Here is our pie chart for Carson City. Carson City used the funding for youth vaping prevention, reduce youth social isolation, and increase physical activity, and provided transportation to medical care for seniors. The Central Nevada Health District used all of their funding for IT operational capacity. Central Nevada Health District serves Pershing, Mineral, Eureka, and Churchill counties, as well as the city of Fallon. And this investment enabled them to improve their data collection and communication, improve telehealth capabilities, and also strengthen data security. Northern Nevada Public Health, serving Washoe County, invested in a number of things. I'll go to the next slide here, but I'll just stop for a moment to highlight that investment in communicable disease control and chronic disease and injury prevention, core functions of governmental public health. How does this funding help the Washoe County community? It supports small business, primarily minority-owned small businesses, to enter the food service industry, prevents the spread of communicable disease, reduces the number of youth that vape, purchases vaccines, prevents the spread of mosquitoes in dense neighborhoods, and also ensures the most cost-effective and efficient public health infrastructure by investing in organizational competencies. Here is our Southern Nevada Health District investment, serving Clark County. Southern Nevada Health District expanded disease surveillance, invested in preventing youth vaping, and launched mobile health units. Here's a more detailed slide showing how they've invested their dollars. So expanded disease surveillance workforce, that's a very important one. And what that means is that we have faster STI outbreak responses, improved prevention, and better access to care. For the sake of time, I won't read the whole slide, but we also have substance use intervention, public health lab expansion, youth vaping prevention, and safe drinking water. All of these examples demonstrate how a flexible investment empowered innovation at the local level and also enabled health districts and local boards of health to identify the priorities most important to their community. So in summary, SB 118 did a number of things. And I'll move to discussion of cuts in the next portion of this, but it preserved essential services, and it continues to preserve essential services such as immunizations, laboratory capacity, disease investigations, and outreach to reduce STIs. It helped to modernize our public health infrastructure, which has been long overdue in the state and also nationally. And then in rural and frontier counties, it catalyzed critical conversations about local public health. It's been a longtime priority of the Division of Public and Behavioral Health to work towards more local infrastructure. This funding enabled those conversations to happen at the local level and start to imagine what it could look like to have more local infrastructure. Okay, so what I'd like to do now is transition to SB 423. There you have an amendment before you. I just want to highlight on the proposed language The amendment is correct, although on my summary on the front, it's $225,000 per county base. I'll go into this, but I just want to highlight that is a typo, and sorry about that. So with the amendment, what does SB 423 do as amended? With the proposed amendment, it builds directly on SB 118's momentum with a focus on statewide sustainable public health infrastructure. Given this body's support for the continuation of SB 118 in the governor's recommended budget, again, sincerely thank you. Our awareness of the funding challenges currently facing the state. We're here before you today, not with a $30 million ask, which was what was in the original interim bill, but with a request to do statewide base funding in the amount of $4,925,000. The other addition to the another point on the amendment I'd like to highlight is that we are requesting to delay implementation to 2027. Again, allowing for us to plan for this sustainable funding. The sustainable piece is what is most important because you can build new programs when you can anticipate those funds coming year over year. And this will enable that period to be smart about what our budget currently looks like, but also enable some additional planning. So, what does it do? It creates the account for public health. It allocates flexible, ongoing funding to local, tribal, and state public health partners. It restricts the funding to foundational public health services, and it uses existing oversight bodies to ensure transparency and accountability. Funds are allocated by county with dedicated funds for tribal and state service and administered through Nevada's Division of Public and Behavioral Health. This approach ensures equity, transparency, and impact across all of Nevada. This is a dense slide, and I won't read all of it, but this is probably one of the most important things for us to discuss here today. We do have health district experts in the room here in Carson City and down in Las Vegas to speak to their specific jurisdictions if you'd like. But here's the challenge. As of March, per DPBH estimates, Nevada lost nearly $100 million in federal CDC and SAMHSA grants. The epidemiology and laboratory capacity grant was $75 million. Nevada State, the NSIP grant, the immunization program grant, was $11 million, and SAMHSA $10 million. That funding supported epidemiology, lab testing, immunization, and behavioral health. Whether those funds will come as a result of court decisions, we do not know yet, but a number of these grants have been terminated, and we know that funding is no longer coming. The result is staff layoffs, halted programs, widening gaps in essential services. And even before these cuts, Nevada's health authorities have been facing decreases or total cuts to programmatic grant funding. SB 423 is a timely response to this funding cliff. It will not fill the many holes created by these cuts, but it will enable the development of a strong, sustainable local infrastructure that can work to pull down federal funding and plan efficiently and effectively at the local level. Nevada's public health system already faced challenges before these cuts. We have limited governmental public health infrastructure across a vast geography. Nye, Elko, and Lincoln counties, for example, are among the U.S. top 10 largest counties. Clark County is the 11th most populous county in the nation and 22nd largest by area. That's out of 3,244 counties. And the reason that matters is because when we look at what public health infrastructure looks like in other states, there's often a local health department or local health district for each county in a state. And this is for states smaller than ours that maybe have 100 counties, 120 counties, 170 counties. And so we really have a bare bones infrastructure across the state. That's a good thing in some ways because we don't have to try to dismantle inefficient infrastructure, but what we don't have is the baseline infrastructure that we should. And so this will help us build it. We're ranked 43rd in overall health, 49th in clinical care, according to America's Health Rankings 2024 report. And our hybrid state and local system leaves gaps, especially in rural and frontier areas. SB 423 is about closing those gaps and creating a more equitable, sustainable system. Together with UNR Extension, NACO assessed the expertise, capacity, and level of implementation of the foundational public health services across Nevada's suburban, rural, and frontier counties over the past 2 years. We found significant gaps in uneven implementation of the FPHS due to limited staffing and funding, not a lack of will or lack of commitment. SB 423 is designed to help every Nevada community meet the basic standard for public health and hopefully get this image that shows from lacking no services to fully implemented or meets demand, at least to sufficient services. Nevada is not alone in having a patchwork like this for their public health FPHS assessments, but we can certainly do better than this for the Nevadans. Okay, I'd like to talk a little bit about the opportunity. So Nevada is part of the 21st century public health learning community. We've joined 17 other states in modernizing our systems. We are learning from national best practices. We're engaging with other states. We're looking at what other states are doing in order to craft the best public health system that we can. States like Kentucky, Minnesota, Washington, and Indiana have already codified FPHS into law and local investment in local public health. SB 423 brings Nevada in line with these emerging best practices and enables a targeted, coordinated approach to the development of the state's baseline public health infrastructure. Okay, so SB 423 with the proposed amendment allocations, this is what the funding would look like. It's simple and fair. It's base funding for each county plus separate state and tribal allocations. We need to also support our tribal governments and tribal partners in developing their public health infrastructure. Any gap in our state is a gap that puts us all at risk. We need a strong system across the state. And then we also need a investment for the state team. So SB 118 was all per capita to local health authorities. It is very much needed in those places, absolutely. But one thing that we didn't do with that funding is fund the state to work on their own internal processes to support what is public health going to look like across the state into the future, and how will that team support the 10 counties that are still their primary health authority, and also deliver on the services that only the state can do from a statewide perspective, right? The state also supports our larger health districts in a number of ways. And just to assure this body, the restriction to FPHS, what you have here, these are the foundational public health services. The bill restricts the funding just to foundational public health services. This means no pet projects. It means limiting duplication. And it means that we're really focusing on building the essential services that only governmental public health, or in most cases, it's governmental public health, provides those services. And the opportunity, the insurance premium tax. So to fund this initiative, SB 423 uses the insurance premium tax, or IPT. It's the fourth largest source of general fund revenue, and it's growing, especially due to Medicaid managed care payments. It's a logical and sustainable choice to support the public health of all Nevadans. It's a 3.5% tax on insurance premiums. The 2025 to 2027 LCB fiscal brief forecasted an 18.4% increase in IPT collections for the 2023-2025 biennium over the previous biennium. There is precedent for supporting critical state infrastructure with allocations. For example, the first $7.6 million of unclaimed property revenue supports the Millennium Scholarship Trust Fund. Cannabis taxes support education. So when we take a look at like what do we really want to deliver as a state, foundational public health services is an aspirational goal, but something that we can achieve. And it'll take sustainable state dollar investment in order to get that done. So in closing, SB 423 builds on the proven success from SB 118. It aligns with national models, it addresses urgent public health gaps, and it strengthens Nevada's capacity to respond to current and future health challenges. It's an investment in resilience, equity, and healthier communities across our entire state. And I do just want to end with this, that baseline foundational public health services, or getting to green on that chart that we saw that was littered with orange and yellow and red, it is aspirational, but it is feasible over time with planning and investment, and we ask you to support that today. So any questions, happy to answer, and also happy to pull up our colleagues from across the state who are the local health experts.
Thank you so much. Committee members, do we have any questions? Where do we start? Senator Titus?
Thank you, Mr. Chair, and thank you for presenting the bill. I appreciate it. I appreciate the thought about not doing it per capita. We had that discussion for my particular county when it was a miscalculation about per capita people living in our county. So I like that component of. I have a couple of specific questions. So based on the amendment that you dropped off, under the amendment under Section 3, going down to number 5. Number 5B, it talks about 300,000 allocations pursuant to Section 4 of this act to health authorities, which are Indian tribes. So are we talking about one bucket of money that then will be allocated to the all the, I think we have 28 separate tribal nations here, or are we talking about those that have distinct healthcare services located on the tribes? Who will decide that?
I'll answer that one. The goal is actually to give that towards the Tribal Health Authority, which we passed today at a committee. So that's the entity that will coordinate all the FQHCs and all the entities of the tribes that deal with public health. So that would be the goal for that one.
Thank you. So it will be a total of the 300 to that entity, and then they can disperse it how they choose to disperse it.
That's correct.
Was that language in there?
It's not reflected in this amendment, but we can certainly tweak it if we want it specifically tailored towards that.
All right,
So,
just for clarity. And then if I might, Chair, the $300,000 that you proposed to counties, just clarification, or actually it's $225,000 per county board of health. And that's in addition to what you might give to health districts. We have 3 distinct health districts. Can you clarify how that money will, if you give it to a health district, will the county still get the additional funds?
Thank you for the question through you, Chair, to Senator Titus. So this is part of why we had to make some adjustments in the amendment. The original intent and the way that it is drafted currently, there would be a base $225,000 per county to their health authority. So where you have health districts, so for example, for Central Nevada Health District, those 4 counties, their funding would be available for Central Nevada Health District to apply. It's the way it's drafted, they request the funding from DPBH. So for those 4 counties, the Board of Health for those 4 counties would collectively make that, the Central Nevada Health District Board would make that determination of greatest need and what the priorities are, and they would receive those funds from DPBH. For all of the counties that are served by DPBH as their health authority county, the Board of Health would make those priority decisions just as they did for SB 118, but again with that DPBH or Division of Public Behavioral Health oversight. So it's a single allocation of $225,000 per county to their health district. So the counties would not get, it would not double up. It would just be $225,000 per biennium per county.
Okay, so, but the total, let's say in the Central Nevada, that's 4 counties, that'd be about $100,000, but it would not, but when it's dispersed, they would have to make sure that each county within that district gets the $225,000? Or can the district, the 4 counties in that district, one mass, they decide where that money goes as a whole?
Yes.
That's what I'm trying to break
Yes, so
down
it's
here.
the latter. So it would be the District Board of Health's decision. And so each of those counties have representation on that District Board of Health, but the Board of Health would receive the $1 million over the biennium because they would get $225,000 per county that they serve, and they serve 4. So they would have $1 million over the biennium.
So a tranche of money goes to the health district?
Correct.
And those counties, such as ones that I represent, most of them, although, yes, some of my counties are in the other district, they would go to the state, and then they would apply to the state where that money goes, as opposed to coming to the health.
This is a great question. Yes, it is.
Because I sit,
yes.
I mean, I'm chair of our
Yes,
county health
absolutely.
district. I mean, I don't want 220,000, you know, and I would need to recuse myself from this vote because I sit on as the chair of our health district.
It's a great question. So the way to ensure the proper oversight using the bodies that we currently have, the money in the account would be dispersed. The DPB, Division of Public and Behavioral Health, would manage the funds in the account. All health districts, including Southern Nevada Health District, Northern Nevada Public Health, Central Nevada Health District, the Tribal Authority, and then all of the county boards of health, in subsection, let me see, I'm going to pull it up here. They would go through the same process we did for SB 118. So they would have to prioritize, they'd have to assess and prioritize, and then they would request from DPBH the allocation that has been allocated per their county. The additional requirement beyond SB 118 is that only spending on FPHS or Foundational Public Health Services. Then they would have an interlocal agreement with DPBH. Again, same process we did with SB 118 to receive those funds locally. So all health authorities, whether it's a tribe, whether it's a county board of health, or whether it's a health district, will have that DPBH oversight. And I think this part's really important because it enables us to take a statewide look at what our foundation looks like, our public health foundation, and, you know, be able to have the state respond to counties and say, okay, that's great that that's your local need. Here's an initiative we're doing at the state that you could, you know, supplement that work with. Or, hey, we're actually seeing that in your county you have this huge public health issue. You don't know how you want to spend the funds. Like, maybe here's a great suggestion for you. The other thing we envision with this is that $225,000 per biennium is actually not a lot of money, right? You can't do a lot with that. But if you think regionally, or you're very strategic about, say, a mandated state service that you'd like to take locally, you could then combine with another county. You could match that with local investment. You could decide, hey, we're going to take on this one piece locally, you know, with state support. And that is, you know, a position, and you could do that with that investment.
Thank you, Mr. Chair. I just want to make sure the intent of the distribution of these funds. So thank you.
Any other questions? All right, let's open it up for testimony. So if you can just go ahead and take a step back. The 15-15-15 rule applies. And if folks can please come forward, both in Southern Nevada and here in Northern Nevada. And you may begin.
Thank you, Mr. Chair. Dan Musgrove with Strategies 360 today. Happily being here on behalf of the Elko Band, Las Vegas Paiute Tribe, and the Reno Sparks Indian Colony. We want to thank the emphasis that the counties now and in the past and the chair have placed on tribal health, and we support this bill. And thank you for bringing it, and thank you for NACO's work on it.
Dr. Chad Kingsley, CHAD KINGSLEY, District Health Officer for Northern Nevada Public Health. I want to take this opportunity to thank Amy Hines-Sutherland and NACO for presenting this and doing an amazing job, as well as for the Interim Health Committee on realizing the importance of public health funding for our Nevada communities. Rick, we just want to be able to emphasize what this means for local health departments. In Northern Nevada Public Health, a nurse case practitioner in our tuberculosis clinic is grant funded. That grant was not able to cover all of her salary. Thanks to SB 118, that helped us to be able to shore up that resource there for our community. A case over our last year was a healthy U.S.-born male child that was born to a 26-year-old mother that was healthy as well. Home in that household was a undiagnosed active tuberculosis case. That child then and the mother both contracted tuberculosis, and they were admitted to the hospital. That child spent several weeks in a critical care, and was both his lungs collapsed several times and heart stopped and needed to be resuscitated. That child is now recovering, is healthy, and is continuing his treatment through rehabilitation. But this is what this money does. It helps us to shore up in our communities those vital necessities that we have, and I thank you for the support of that.
Good evening, Chair and members of the committee. My name is Taylor Allison, last name Allison, on behalf of Lyon County. We'd also like to thank NACO for the presentation and reiterate that we think Senate Bill 118, as passed, was a great success in our community and our ability to connect community members to existing resources as it relates to traffic safety, youth mental health, and sexually transmitted infections. This critical base level funding allows counties to address our unique community's needs while aligning with that standardized foundational public health services. It's an investment to buy down our future healthcare costs and reducing and moving that needle on preventable chronic health. So we urge your support and thank you for the time.
Good afternoon, Chair and Committee. I am still Sabrina Schnur, Sabrina Schnur. I am still here on behalf of the Nevada Public Health Association. MPHA submitted a letter in support, so I won't take up too much time. I did just want to highlight my favorite part, which is historically public health agencies in Nevada have relied heavily on federal funding from sources such as the Center for Disease Control and Prevention, funding that is typically obligated for a very specific purpose, such as vaccines. SB 423 will improve the capacity of health authorities in Nevada to address public health needs and priorities unique to local jurisdictions. So thank you to Dr. Hines-Sutherland, and thank you for this time.
Hello, Chair and members. Sheila Bray, University of Nevada, Reno. I'll just echo with a lot of what was already said, and just also highlight that yesterday we We had brought over 90 students, faculty, and staff from our School of Public Health to advocate for the importance of public health within local communities, and I think this bill goes really far to do just that. So thank you, and we're in support.
Good afternoon, Chair and members of the committee. My name is Nikki Aker. Last name is Aaker. I'm the Director of Carson City Health and Human Services, and I am here to fully support this bill and thank you to Amy and all the others that put time into this. Funding like this, which you've heard it called non-categorical funding, offers the flexibility for counties to work on their priorities, which are identified in possibly a community health needs assessment. And for funding for us we did a Quad County community health needs assessment, and those priorities were access to basic needs, access to healthcare for specific populations, mental and emotional health, substance use, prevention, treatment, and recovery. You saw by the presentation what we used some of our SB 118 money for, which included youth vaping prevention, reducing social isolation among youth, while promoting physical activity, expanding transportation services to medical appointments for our seniors. And today we decided upon a rapid syphilis test that's going to be used, and hopefully that will help reduce our congenital syphilis that those individuals hit our emergency rooms. So you can see we're in the process of using this money with ways that it makes sense for our community, and we're looking at implementing additional health improvement initiatives in the near future.
Thank you, Chair and members of the committee. Blaine Osborne, Nevada Rural Hospital Partners, for the record. Happy to be here in support of the bill and the amendment. Really want to thank NACO, Dr. Heinz Sutherland, the public health districts, and everybody else that put the work in on this one. Thank you.
Thank you, Chair. Members of the committee, Allison Herzik, Director of Nevada Government Relations for Dignity Health St. Rose Dominican. We supported Senate Bill 118 during the 2023 session and believe this funding is critical in supporting Nevada's public health infrastructure. We'd like to thank NACO and the partners that continue to advocate for these funds, and we appreciate your time and consideration.
Thank you so much. Let's go to Las Vegas, please.
Good evening, Chair Donate and members of the committee. For the record, Cassius Lockett, Cassius Lockett, and I serve as the District Health Officer for the Southern Nevada Health District. I'm here today in support of SB 423, which will provide flexible, sustainable funding needed to build and maintain Nevada's public health infrastructure for the long term. First, I want to thank the governor and legislatures for their commitment to public health through SB 118, Public Health Improvements Budget. That investment has enabled SNHD to retain and expand critical public health services that protect Nevadans every day. However, the unprecedented cancellation of $11 billion in federal funds on March the 24th still underscores how vulnerable we are without a stable funding source. Reductions in categorical federal funding are creating a growing structural budget deficit across the state, across the country, pretty much threatening essential program staffing and services statewide. SB 423 directly helps address this urgent need by ensuring consistent funding of foundational public health services that safeguard our communities against both everyday health risk and future crisis. Without this type of legislation, Nevada risks losing ground on the progress we have made in protecting public health and ensuring communities' resilience. You've heard some of the examples today. SB 423 offers a clear pathway forward, flexible, sustainable funding that strengthens our capacity today and into the future. So thank you for your consideration of this measure and for your ongoing support of public health in our state. And thank you, Amy. Great job.
Thank you so much. Seeing no one else in Las Vegas, AVH, is there anyone online?
Chair, there are no callers in support at this time.
Thank you so much. Let's move on to opposition and testimony in opposition. If there's anyone here to testify in opposition, I don't see anyone here or in Las Vegas. AVH, is there anyone online?
Chair, there are currently no callers in opposition.
Thank you so much. And last but not least, anyone in neutral testimony? I don't see anyone here or in Las Vegas. AVH, is there anyone online?
Chair, there are no callers in neutral.
Thank you so much. To our presenters, are there any closing remarks? Nope. All right, I'll go ahead and close the bill hearing on this one and move on to Senate Bill 410. So let's go ahead and open the hearing on Senate Bill 410. This bill revises provisions relating to public employees. I believe our presenter is coming forward, so you may begin when you're ready.
Senator Donate, thanks for having me here this afternoon. Didn't quite make it evening yet, I don't think, but pretty close. My name is Tom Zumtobel, for the record, Zumtobel. I'm the CEO of the Teachers Health Trust here in Las Vegas. I'm here to present a crisis that's being caused by the rising cost of dependent health care. This is not simply an educator issue. It affects their families, their students, their schools, and their communities. Excessive dependent healthcare costs have significantly impacted educator recruitment and educator retention. Today, I'll cover 3 areas: examine how the high cost of dependent healthcare coverage jeopardizes educator retention, explore various school districts that utilize policies to encourage dependent cost-sharing models, and conclude with a call to support Senate Bill 410. The data in the slide, they're up. Oh. Senator, do you have the slide? Do you guys have the slide up in the north?
You can go ahead and continue with your presentation, please.
Okay. So the data highlighted in this slide is the demographics and the coverage of the Clark County School District educators within the Teachers Health Trust. We serve 17,800 educators with about 16,700 dependents for a membership of approximately 34,000. There's a significant female representation. 74% of our educators are women, 24% of these women are maternity age, and 22% of our educators enroll for benefit coverage with 3 or more dependents. While this presentation applies to all the roughly 4,000 educators in the school district with dependent coverage, the hardest hit are the 570 educators that are single mothers or single fathers that absorb the high cost of dependent coverage with a single salary in their family. The problem we face is the increasing cost of healthcare places a significant financial strain on the educators, particularly those in rural and high-risk schools. Educator shortage and turnover disproportionately affects students in these settings. Schools in underserved and rural areas are often essential community support systems. The loss of an educator can disrupt this community support system. We must ensure that the school district policies include consideration of dependent healthcare coverage. Currently, CCSD lacks such a policy. As well, they do not acknowledge that the expense of dependent healthcare coverage is a major contributor to their recruitment and retention problems. This slide is an example of an educator that is actually a typical CCSD educator with 2 children and faces a tight financial situation. She has an annual salary of $55,000 a year, which is the starting salary for most educators. It's a common salary. As you can see, the monthly expenses exceed her gross income. And so for a single educator, currently, the monthly expense to cover her family is $800 in premium coverage for the dependent coverage, which is 17% of her gross salary and almost 25% of her net salary. This next example is a similar one with a single educator that actually has 4 dependents, and it continues the theme of financial strain. This slide focuses on the single educator with 4 dependents that the budget reveals a significant shortfall. And at the end of the month, her actual real expenses exceed her monthly gross salary. And this is the cause of many of our educators being forced to secure secondary sources of income. And the financial pressure leads to high turnover rates, ultimately affecting the quality of education and the support available to students. This last example is at the current average rate for CCSD, which is $65,000 of annual salary for an educator. This slide illustrates that even with the additional income, the educators still face significant challenges with the higher salary. Despite the increased income, the budget reveals that there's a significant burden and that gross cost barely covers the net expenses for a teacher each month. And again, they're forced to find other sources of income. This next slide is 3 examples of other school districts that actually by policy have determined that it's important for them to fairly treat and address the challenges that are faced by these educators who are paying for dependent coverage. The Denver Public School District contributes extra funds for dependent healthcare premiums in an effort to seek equity for larger families. The Miami-Dade County School District uses a variable contribution model based on the family size and the salary band to promote fairness. And the Los Angeles and San Diego Unified School Districts both cover 100% of educator premiums and 100% of premiums for dependents. Each of these models provide insight into the potential solutions if a school district builds a cost-dependent care strategy into their policies. In conclusion, I urge you to support Senate Bill 412. It's essential to ensure school districts implement policies that consider recruitment and retention and community health. This effort is foundational to establish our equitable and sustainable solution for educators and families. Thank you for your time. I'll make myself available for questions.
Thank you so much. Committee members, do we have any questions? I just have a quick one. So what we're looking at this bill is not making it mandatory that they have to provide benefits for covered dependents. It's that there's an ability to collectively bargain for it, correct? So it's more explicit. Okay. Just want to double check because I know the fiscal note said that. So, all right. Any other questions? Let's go ahead and open it up for support testimony. So if you would like to support this bill, please come forward. And we'll start the clock. It looks like we have folks in Southern Nevada, so you may begin when you're ready.
Good afternoon, Chair Dante and committee members. Marie Nices, M-A-R-I-E-N-E-I-S-E-S-S, President of CCEA. I want to thank Senator Danyante for bringing SB 410 forward, and I am speaking in support. SB 410 is critical for the well-being of our educators, especially given the rising cost of healthcare, which continues to place a significant financial burden on families across our state. The majority of educators are women, many of whom are caregivers for children or other dependents. As healthcare costs rise, educators face an increasingly difficult challenge in providing quality care for their families, while maintaining the demands of their teaching careers. The financial strain is growing, and it is unfair to expect educators to shoulder this burden alone. By allowing bargaining for dependent coverage, we are not only supporting the health and welfare of educators, but also recognizing the essential role they play in shaping the future of our communities. Fair and affordable healthcare should not be a barrier to retaining and attracting dedicated educators, especially women, who often bear the financial responsibility of caregiving. This bill represents a critical step towards creating a more equitable and supportive environment for educators. It allows them to focus on what matters most, teaching and inspiring students, without the additional stress of unaffordable healthcare costs for their families. I strongly urge you to support SB 410 and stand with educators and their families in securing fair and affordable comprehensive insurance coverage. Thank you for your attention to this vital issue.
Good evening, Mr. Chair and members of the committee. My name is Jessica Jones. I'm an educator at Hickey Elementary School on the east side of Las Vegas. I also serve as the secretary of the Clark County Education Association. I'm here to speak in support of SB 410, which clarifies that insurance benefits includes benefit for dependents within the scope of the mandatory bargaining. Currently, Clark County School District will not discuss this topic when we're in negotiations due to the vagueness of the language in the law. This will differ from how the county government views this language. In the fiscal note, Clark, Washoe, and Lyon County include dependent benefit negotiations under the existing language of the law. So as the presenter, Mr. Zumtable, said earlier, teaching is a female-dominated profession, and here in Clark County, women make up the majority of educators. As a single mother and the sole provider for myself and my 2 children, the rising cost of health insurance has forced me to make some very tough decisions. My insurance premiums increased to $768 a month. So it forced me to switch to a high deductible plan at $495 because I needed to save that $273 within my budget. And while that lowered my monthly costs, I end up paying more out of pocket when we need medical care, because with a single income and 2 kids, $273 is a very significant amount of money for me. And I'm left hoping on a month-to-month basis that I don't need to see a doctor, or that my children don't as well. That's not what health insurance should be about. Recently, our presenter, Mr. Zumtable, also gave a presentation to our school board about premiums for young families with more than 2 dependents and how they are too high given an educator salary. That is something he emphasized to our school board is an issue they want to address. But like I mentioned earlier, the Clark County School District doesn't negotiate this issue with our union. So what does that mean when we can't negotiate insurance contributions for dependents? Well, many educators may face similar financial struggles as I have, and they may leave the profession due to the high cost. As more young teachers begin to start families, the issue becomes even more pressing. I teach at a Title I school in East Las Vegas, so we have had high vacancies. I currently know a teacher at my school right now that won't be returning this fall because of this issue. I believe that clarifying this matter and allowing the labor negotiators to address the cost of dependent health care, as other counties have during negotiations, will not only help recruit our educators, but retain them as well. And for those reasons, I urge this committee to please support SB 410. Thank you.
Thank you, Chair Donate and members of the committee. My name is Tyler Sutton. I am one of the executive board members of CCEA. I'm going to read a brief testimony from one of our members, Summer Wells. Good afternoon, Vice Chair Taylor and committee members. For the record, my name is Summer Wells, member of CCEA and an elementary teacher at Hickey Elementary School. I'm speaking in support of Senate Bill 410. I am the sole worker and the only one who covers my entire household with insurance. Each paycheck, I pay $368 for dependent health care, which is $736 per month. This is a lot of money, and it's a hardship on my family. It's difficult to pay for my kids to do extracurricular activities, along with making sure that they have food to eat. Not to mention my mother-in-law is now moved in with us, so there's an extra mouth to feed. Food prices are very high right now, and it's a challenge to put food on the table or pay a bill. Passing Senate Bill 410 will allow us to negotiate dependent health care, reduce the out-of-cost expense to maintain health insurance for my children, and recruit and retain more teachers within the profession. Committee members, I urge you to support this bill. I want to thank Chair Donate for his leadership and support on this issue, for the committee members for hearing me out. Thank you.
Good afternoon. My name is Angie Joy, and I'm reading on behalf of Joanna Annie Braze in support of Senate Bill 410. Good afternoon, Chair Donate and committee members. My name is Annie Braze, and I have spent 15 years teaching in the Clark County School District. I had children late in my career and at a later age than many, at 37 and 40. After having my first child, my premiums increased by $270 a month, which was a bit of a shock, but somewhat understandable. The real shock came after having my second child, when my premiums increased by 200% from having one dependent. I currently pay $766 a month for my 2 children, a $490 a month increase from just one dependent. This is more than $9,000 a year that I spend on just premiums for 2 children, and doesn't include any out-of-pocket costs I incur towards deductibles, copays, and out-of-network fees. For a first-year teacher, this equates to more than 15% of their salary. When I became a teacher, I was excited to work with children and fulfill my dreams of helping and guiding others. Unfortunately, I feel like I'm always trying to keep up financially between the cost of childcare, living expenses, and insurance premiums. Of course, having health insurance is a necessity and priority, but it comes at a great cost to my family, both financially and emotionally. I would never put my children or myself in a situation where they are not covered, but paying over $9,000 a year just to have insurance for 2 children places a significant financial strain on my family. I am asking that you please consider contributing more funds to help lessen the financial burden on educators and their families. My hope is that educators can move forward, focusing on being the best they can be for their students and families without this significant financial hardship. Respectfully, Joanna Annie Brays. Thank you.
Thank you so much. I don't see anyone else. AVH, is there anyone online?
Chair, there are no callers in support at this time.
Thank you so much. Let's go to opposition testimony. If there's any opposition testimony, please come forward. And you may begin.
Good afternoon, Mr. Chair and members of the committee. For the record, my name is Mary Przenski here representing Nevada Association of School Superintendents. And this is really a tough bill to oppose because I think all of us want health care for our families. But we have 23 things that we negotiate now. And adding this, especially at this time when the finances of not just our school districts, but the entire nation are in flux. And this might be a good bill down the road, but right now it's just not a good time to try to add number 24 onto our negotiations. I'd also like to mention that if you are a person who has dependents, and so you're getting that extra money, if I'm a single person with no dependents, is our pay equal? I mean, there's some negotiations I think would have to be included there because it would seem one person is getting more than another. So at this point, we are opposing the bill, but happy to talk further about it and perhaps come up with some amendments that would help us understand it better and support it more. Thank you very much.
Senator Lang has a question.
Hi. So what I am thinking about, and I really wanted to hear your testimony before I brought this up, but this bill is just asking for the opportunity to negotiate. It's not saying it has to happen. And so it's not committing the district to any money. It's saying they have the opportunity to have those discussions, which might be healthy for the school district.
Thank you very much. I think we're coming from the angle that when it's listed, along with negotiations, become expectations, but I'll let my colleague.
And your name for the record, please.
I'm sorry, Mary Przenski. Thank you very much.
Brad Keating for the record, Clark County School District. And I sit with Mary Przenski, and I know we have a lot of excellent educators down south, so this is not a fun one for me to be on the opposition side. We certainly would love to give every single thing we possibly can to our educators. That's our goal. That's what we strive to do every single day. I think as we look at policies moving forward, especially in this legislative building, this is not the only bill being discussed in the legislative body that would open up the collective bargaining provisions and adding provisions and topics that are discussed. We're just worried as a district and across the state as superintendents that as we continue to open up more and more subjects of bargaining, that it's going to dilute or make it a difficulty to fully hit any of those areas. So what we're nervous about is just as we continue to open, the funds are just less and less spread across the base.
I would just encourage you to have conversations, because I think there's a way to make this happen that's good for everyone. And I want the districts, we've worked really hard in this legislature to raise salaries so that we can keep people here. And I just don't want this to be a deterrent for people to leave the districts. I think we have to work really hard to do what we need to do to make sure our educators are staying in Nevada.
Can I ask a quick follow-up question? I just wanted to, perhaps this is more for clarification. What is right now, so it's my understanding that dependents are not covered, and perhaps you can answer this from CCSD. how many of the school districts do we know that do offer this as a benefit versus not as a benefit? Because my understanding is only Washoe County School District submitted the fiscal note and no one else did. So I just want to know, like, what does the lay of the land look like?
All right. Thank you, Mr. Chair. For the record, my name's Mary Przenski. I don't have that information for you right now. I know Carson City does not, at least when I was superintendent, we weren't doing that. But I'm happy to get that information for you and let you know who has actually negotiated agreements for dependents. The superintendents, I usually survey 3 rural superintendents on the different bills, and the ones I surveyed were not offering that additional amenity or so. Any rate, but I'm happy to get that list for you if you'd like to see it. Okay? Thank you.
Thank you. Mr. Keating, I don't know if you wanted to answer that.
I think in our understanding and working with the superintendents across the state, the reason that it's difficult to put a fiscal note on this bill is it allows for the conversation to occur. It doesn't mandate in any way, shape, or form. So we didn't want to go ahead and put a fiscal note, and also not knowing what we would negotiate at the end of the day, how that would see at the end of the day. So we didn't want to mess anything up as we go through the policy.
Thank you. So just as a clarification, does CCSD believe that it is not their responsibility to cover dependents and it's only focused on the employees then? If that's the interpretation that you guys are making it right now.
Yeah, Brad Keating for the record. Our current, the way the current system operates is that we cover the employees and then we offer the opportunity for employees to pay for their dependents after that.
Great. Thank you.
Yeah.
All right. Anyone else here in Carson City? I don't see anyone else either here in Las Vegas. AVH, is there anyone online?
Chair, there are no callers at this time.
Thank you so much. Let's move on to neutral testimony. Is there anyone that would like to testify in neutral on this bill? I don't see anyone here or in Las Vegas. AVH, is there anyone online?
Chair, there are no callers in neutral at this time.
Thank you so much. I don't know if our presenters have any closing remarks in Las Vegas. See Tom coming up.
Thank you for letting me come back up, Senator. I appreciate the discussion. Senator Lang, I appreciate your questions. And that really is the point, is get it on the table. Let's discuss it. We understand there's negotiations, but if things are off limit in a negotiation, how do you get to a fair end? And so that's where all I'm just trying to do is get everything on the table that affects the teachers' recruitment and retention, which is good for the community and good for all of us. So thank you very much.
And Tom, before you go, just as a quick, I don't know if you're able to answer this just as someone that works in healthcare. Other public employees do receive coverage for dependents. Is that a fair assessment? Is it just specifically in what you guys are encountering?
That's a fair assessment. Counties offer some portion of, in different plans. Employers, it's part of the recruitment and retention strategies. So it's common for employers to pick up some portion of the dependent coverage.
Thank you. And thank you so much for your presentation. At this time, I'm going to go ahead and close the hearing on this bill and move on to our next one, which is Senate Bill 408. So I'm going to go ahead and open the hearing on this bill. This bill revises provisions relating to county hospitals and county hospital districts. And I will go ahead and invite our presenter to please begin.
Good afternoon. Chair Donate and members of the Health and Human Service Committee. My name is Shauna Tello, for the record, SHANATELLO, Academic and External Affairs Administrator. I'm here testifying for Senate Bill 408 on behalf of University Medical Center. UMC has served the people of Southern Nevada for more than 94 years, growing alongside Las Vegas to become the state's most sophisticated healthcare system and a vital asset during our community's greatest times of need. UMC has never lost sight of its important mission to deliver the state's highest level of care to all patients, regardless of their insurance coverage or ability to pay. UMC is uniquely positioned as a nonprofit public hospital offering advanced care that isn't available anywhere else in Nevada, including the state's only Level 1 trauma center, verified burn center, and transplant center. As a result, UMC cares for many of Southern Nevada's most critically ill and injured patients. University Medical Center is pleased to present Senate Bill 408 and is proud to open the first crisis stabilization center in Southern Nevada with 24/7 access. This crisis stabilization center will allow UMC to continue serving the community's needs by treating individuals experiencing a mental and behavioral health crisis and decompressing the emergency department by ensuring the appropriate levels of care are provided. The Crisis Stabilization Center will assist individuals with stabilization, community resources, medication, and other discharge-related follow-up. The goal of Senate Bill 408 is to clarify UMC's ability to provide the additional services needed, such as medical detox, counseling, intensive outpatient therapy, as part of the patient's continuum of care. Senate Bill 408 will give UMC the authority to provide these services through a separate organization or provider number where needed, which will have a profound impact on the community as we care for individuals in crisis. The next section of this legislation involves modernization of language in relation to employment terms of interns. UMC currently has the authority under the law to employ physicians, dentists, and interns. The revision to this section is to modernize intern to residents and fellows. Also presented was a conceptual amendment to provide clarity to apply the language to dental residents. Lastly, UMC remains committed to building upon its legacy and elevating the level of care available in Southern Nevada. Thank you again for this presentation and your indulgence. We're available to answer any questions.
Thank you so much. Committee members, do we have any questions? Senator Lang.
Thank you. You told us about the conceptual amendment, and I'm looking at it on my computer. Do you accept that conceptual amendment?
Yes, Senator
Okay,
Donati.
great, thank you. Friendly amendment.
Thank you so much. Any other questions? Let's open it up to testimony if you want to take a step back. And anyone that would like to testify on this bill in support, please come forward.
Thank you, Chair and members of the committee. Blaine Osborne, Nevada Rural Hospital Partners, for the record. Happy to be here and supporting our friends at UMC with Senate Bill 408. In NRS Chapter 450, there are actually 8 hospitals affected. The most prominent is obviously UMC, but then there are 7 critical access hospitals that also fall into that chapter. And so we are here in support of this bill. It probably won't have really major impacts or opportunities for our little critical access hospitals, but we appreciate the intent, and again, happy to be here in support and the amendment. Thank you.
Good evening, Chair Donate, members of the committee. Joanna Jacob, JACOB, on behalf of Clark County, here in support of the bill as amended. UMC is partnering with the county, and you've heard about this in interim finance committee over the years on the crisis stabilization center reference. This is something that the county has been working on for a number of years. We're very excited that it is moving forward in partnership with UMC, and in addition, we think that this is going to give us the flexibility to partner with UMC on additional services that we need for our community. And as the safety net for Clark County, and the UMC is the safety net for anchoring our community, we think this is a positive step forward. We want to make sure that they have what they need, and we are in support. Thank you.
Thank you so much. Anyone else in support? AVH, is there anyone online?
Chair, there are no callers in support at this time.
Thank you so much. Let's do anyone in opposition. I don't see anyone here in Las Vegas. AVH, is there anyone online?
Chair, there are no callers in opposition at this time.
And last but not least, anyone in neutral on this bill? I don't see anyone here in Las Vegas. AVH, is there anyone online?
Chair, there are no callers in neutral at this time.
Thank you so much. Any closing remarks? Nope. All right. I'm going to go ahead and close the bill hearing for this bill, and I thank our presenters for joining us today. And so we will go ahead and close this bill hearing and move on to our last one, which is Senate Bill 409. This bill revises provisions relating to the reporting and investigation of child abuse or neglect, and I will invite our presenter to come forward.
Good evening, Chair Donate, members of the committee. Joanna Jacob, JACOB, on behalf of Clark County, back again with you this evening. With me in Las Vegas is a member of our DA family, Amity Latham, who's going to help us present this bill. This was an interim health committee bill that we presented over the summer to try and fill a hole that we see. So I will turn over the presentation to Ms. Latham and have her present the bill. Thank you.
Hi, good evening. My name is Amity Latham, A-M-I-T-Y, Latham, L-A-T-H-A-M, and I work for the Clark County District Attorney's Office practicing in child welfare. In child welfare, we're responsible for ensuring children are safe from abuse and neglect. Children who are injured by their parents or caretakers need appropriate medical care, and we also need medical opinions. Often these opinions are relied on in court and by Child Protective Services to determine whether a child needs protection because the injuries are inflicted and non-accidental, or sometimes they are not inflicted and they're due to some other medical condition. We take these opinions, we rely on them, the courts rely on them to give judges a full picture of a child's condition. Additionally, a criminal prosecution for the abuse or neglect of a child requires the same medical information from the same medical professionals. However, some medical professionals are reluctant to provide these opinions because of potential liability. So in Nevada, there is times a lack of providers willing to give opinions about child abuse and neglect injuries and in general specialize in child abuse and neglect. So what Senate Bill 409 works to address is these concerns, but even more importantly, it brings Nevada in line with the Child Abuse Prevention and Treatment Act as it was amended by the Victims of Child Abuse Reauthorization Act of 2018. That requires states who accept money for the child welfare system to have immunity from civil or criminal liability for individuals making good faith reports of suspected or known instances of child abuse or neglect and who otherwise provide information or assistance, including medical evaluations in connection with the report, investigation, or legal intervention pursuant to that report. And in Nevada, since 1985, we have implemented those protections through NRS 432B 160. However, federal law currently offers something Nevada doesn't. It offers that under federal law, if a defendant prevails in a federal civil action, the court may award costs and reasonable attorney's fees incurred by that defendant. So what Senate Bill 409 does is it proposes to add a version of this protection to Nevada state law by extending it not to any defendant, but only to mandated reporters. And this should significantly help medical professionals to feel more comfortable in rendering opinions regarding the abuse or neglect of children. Nevada has protected mandated reporters of abuse or neglect for 40 years. In 1987, Nevada amended NRS 432B 160 to add a provision that if there were a proceeding to impose liability against a mandated reporter, there would be a presumption that that mandated reporter of abuse or neglect made that report in good faith. Again, this matches the federal protection language in CAPTA, or the Child Abuse Prevention and Treatment Act. SB 409 would add the final piece of protection that the federal law offers that Nevada is missing, in that in a lawsuit of that nature, a proceeding to impose liability against a mandated reporter. If that mandated reporter or the defendant in that lawsuit were to prevail, they could ask the court for reasonable attorney's fees and costs. Again, they would have the ability to ask the court to reimburse them for the attorney's fees for defending that lawsuit. So with that, that concludes the presentation.
Thank you so much for that presentation. Do we have any questions from committee members?
Finally,
I don't see any questions or comments, so let's go ahead and open it up for testimony. So if you would like to support this bill, please come forward.
Good evening, Senator Dinyate, Health and Human Services Committee. My name is Chris Reese. It's R-I-E-S. I represent the Las Vegas Metropolitan Police Department. I know it's late, so we just want to say that we support this bill. Thank you, guys.
Thank you so much. Anyone else here in Carson City? Anyone in Las Vegas? AVH, is there anyone online?
Chair, there are no callers in support at this time.
Thank you so much. Anyone in opposition to this bill, please come forward. I don't see anyone here or in Las Vegas. AVH, is there anyone online?
Chair, there are no callers in opposition at this time.
Thank you so much. Let's move on to neutral testimony. Is there anyone that would like to testify in neutral on this bill? Seeing none, AVH, is there anyone online?
Chair, there are no callers in neutral at this time.
Thank you so much. Any closing remarks? I'll go ahead and close the hearing on this bill. I just need a 1-minute recess. Give me 1 second. All right, we're back from recess. Sorry, I just wanted to ask a few questions. Given the timeline that we're in, and it is deadline week, I would like to go ahead and, seeing that we have closed the hearing on this bill, make a motion to do pass Senate Bill 409. And so I will go ahead and entertain a motion at this time. We have a motion from Senator Lang. We have a second from Senator Stone. Any discussion on this motion or on this bill? Seeing none, all those in favor, please say aye. Aye. Any opposed? The motion's carried, and I will give Senator Titus that floor statement. So that concludes the bill's hearings for today, and so I'm going to now open up to our last agenda item, which is public comment. So if there's anyone that would like to provide public comment, now would be the time. I don't see anyone here or in Vegas. AVH, is there anyone online?
If you'd like to participate in public comment, please press star 9 on your phone to take your place in the queue. Chair, the public line is open and working. However, there are no callers at this time.
Thank you so much, and thank you everyone for joining us. We ended up a little bit earlier today, and so I look forward to seeing everyone on Thursday, and the meeting's now adjourned. Thank you.